Well, technology seems to be advancing leaps and bounds every day. Just look at our telephones. The new edition comes out all the time. It's not only making things a little bit more convenient, but it's also saving lives. Secours cardiologist Dr. Jeff Senfield is here to tell us more about the advancements available to heart patients. Dr. Senfield, good to see you.
Good to see you too, Jamarcus.
Yeah, good morning.
Thanks for having me.
And like I've said this to you before, the fact that cardiologists are lifesavers. Doctors of all types are lifesavers, but it's very personal to me. I lost my mom to heart disease, so I know what you guys do every day is amazing work. We're here to talk a little bit about the advancements in technology, diagnostics, and things like that. Let's start with how you diagnose heart rhythm issues. What are the advancements there?
And we have plenty of options to diagnose heart rhythm issues. Usually we start our patients out with what we call a monitoring device. People might have heard the term Holter monitor in the past, but in comparison to what we used to have, where you'd have multiple leads on the chest with a little phone device on the side, a lot of the more modern monitors are usually just one sticker you can put on the chest wall, and they can last for up to a couple of weeks, up to a month. And then that information is sent to us in the office to see if any of the patient's symptoms, which could be the feelings of having a fast heart rate, which to a patient could mean palpitations, shortness of breath, maybe even chest pain, or more sometimes severe passing out spells, which could be a marker of a very slow or periods of time where a patient has no heart rate. So those devices can help diagnose those problems for us.
And we've talked a little bit about like the advancements with like how people diagnose these things, but people are familiar with the pacemaker.
Yes.
And that's one kind of model that shows you how much time has moved on and advancements have gone. So.
Yeah, no, the pacemaker is a very important tool, and the pacemaker, came out probably in the 1950s. And the most common pacemaker is the one where we make a small incision up here at usually the left side of the chest, but it can also go on the right side of the chest. And the pacemaker device is, as you see in the top corner there, it has a metal can which encases the battery and basically the CPU. And on the top of it is called the header, where there will be two leads that are basically two long spaghetti noodles or silicon-encoded pieces of equipment that will go into the heart to allow the heart to pace. But interestingly, talking about new technology, we also offer what's called a micro pacemaker, which is on the bottom part of the screen, which is a very small pacemaker, about a ½ an inch, basically a large Tylenol capsule that we actually put in the heart through the groin and inject it into the heart. And that little device is everything that has all the capabilities of a traditional pacemaker, with a nice benefit of not having an incision and not having any other lead components.
And that size difference is just crazy to look at.
It's a 93% smaller size.
Wow.
And it has all the capabilities of what we call a single chamber pacemaker.
Wow. And you were saying that the doctor behind the pacemaker was able to see?
Well, so the person who founded the company Medtronic, by the name of Earl Bakken, is thought to be one of the original inventors of the pacemaker. And originally, the first pacemaker was a big box sitting next to a patient bed with a lead that would come from that box into the patient's body. And you couldn't leave the hospital with that type of pacemaker. You were basically bedridden. You could be alive, but you were bedridden. And in his lifetime, he saw the development of all the iterations of the pacemaker up until the one we just saw do, the Micra. There's a picture of him holding that box, that original box, and holding the pacemaker like this in his hand, knowing that this newest pacemaker, you can walk out of the hospital, live a normal life, and basically not even know what's inside of you because there's no incision.
Talking about saving lives, being able to, from being bedridden, never being able to go anywhere, to now just living a full life with something as small as a Tylenol capsule.
It really is amazing where the technology has gone, and I'm humbled every day that I can be a part of this.
Yeah, talk more about any other treatment advancements that people should be aware of that you guys are seeing every day.
Sure, there's a few other things that come to mind. One is another device that we use for monitoring the heart rates, which I didn't bring up earlier, called the loop monitor, which is also a very small device about the size of a paper clip, that for some patients, they're maybe only have symptoms every 1 out of 3 months, once a year, once every 6 months. That will help us to diagnose those types of arrhythmias because the battery life lasts for 3 years. And we basically inject that under the skin, and that information that gets read by that device is sent to us through a telemetry monitoring system pretty much immediately to help us diagnose those patient problems. The other things that we do in my field are what we call ablations, where patients who have fast heart rates, such as arrhythmias called atrial fibrillation or an SVT, we can fix those arrhythmias and sometimes cure them by the way of catheter ablation, which is using a catheter to make little burn marks in the heart.
It's really crazy and fascinating to see how much these things have changed. And I've heard some of these terms, you know, in the past with my own personal family. So it's kind of cool to hear it in this context. For people that are watching this and maybe saying, are people referred to you from, you know,
Sure.
a hospital, or how does it work?
Well, we accept referrals, self-referrals or physician-based referrals, but a lot of the times a patient will come to the emergency room with one of these arrhythmias that's diagnosed, or say they're about to get a hip surgery and their orthopedic doctor gets an EKG that shows the patient's in atrial fibrillation. That's a lot of how my patients come through and see us in the office. Other times, my partners will see a patient that has one of these arrhythmia problems, and the type of doctor that treats this is a cardiologist, but we're actually called electrophysiologists, or basically I tell my patients we're electricians of the heart.
Electricians of the heart. You guys do great work day in and day out. The number for Upstate Cardiology, Secours, is on the screen there. Be sure to give them a call if you're looking to find out more information about how they can help you and your family. Dr. Senfield, thank you so much for being here. It was really fascinating. I could talk to you all day about heart stuff, but it's really cool.
It's my passion. Thank you very much.
Thank you. And we'll put all that information for you at our website, yourcarolina.tv.